Good deal. Well, good morning. It's great to be back here at the Tampa Firefighters Museum, and I'm very happy to be joined by our wonderful First Lady, as well as our Secretary of DCF, Siobhan Harris. Then we've also got a number of folks who've been involved in our topic here today. So I want to recognize Manny Guevara Ruiz. I want to recognize Lieutenant Jeremy Kohlhauer from the Pasco County Sheriff's Office, Dustin Hawkins, Director of Florida Firefighter Safety and Health Collaborative and a firefighter in Indian River County, and then Captain Rick Vila, Tampa Fire Rescue. We've had a strong focus on supporting first responders of all kind in the state of Florida, and we did, you go back last summer, there was a lot of attacks on law enforcement, and we never accepted that in the state of Florida. We stood by the men and women of law enforcement the entire time, while other areas were defunding law enforcement, slashing police forces. We were funding and then some, and we were happy to be able to do $1,000 bonuses to all sworn law enforcement firefighters and EMTs for this current year's budget. I'm also happy that we're going to be able to put that in again for next year's budget. And so as we get into 2022, as we get into the summer and fall of 2022, we'll have, hopefully, if we are successful in the legislature, which I think we will be, we'll have $1,000 bonuses to all fire rescue, EMT, and sworn law enforcement for the second year in a row. So we're showing that we are standing by folks who stand by us. Also, we've had great proposals for next legislative session that's going to have a huge impact in solidifying Florida as really the best place for being a first responder, particularly with law enforcement. If you're in some of these other jurisdictions and you're being treated very poorly, we're going to do a $5,000 signing bonus if you relocate to Florida. And that could be state agency, sheriff's department, police, you name it. And that's also true for people who are already in Florida but aren't already in the profession. If that's something that they choose to do, they will be eligible for that as well. We're going to do a 25% pay increase for all current state law enforcement personnel, which includes a lot of stuff from Florida Department of Law Enforcement, Highway Patrol. We even have some fire that are going to be getting increased pay as well. So we're happy about doing that, and I think that we've got a lot of great momentum. And it matters. And you look at the places that have not supported these folks, they have much more crime. I just saw a report that some of the New York banks are telling their employees, dress down when you're going into the office so you don't get mugged or something like that. I mean, what kind of a society is that? It's absolutely insane. So we've stood by folks, and the thing is, whenever there's something that happens, these are the folks that are standing by us, and we saw that tragically in June when we had the Surfside Towers collapse. You had folks that were there rescuing people immediately, and then we saw people, primarily initially the South Florida task force, but then all around the state converged to assist in the rescue and recovery efforts. And so that was very meaningful, and I know that they saved a lot of lives, particularly on that first night. But when you're doing this type of stuff, it's not easy. I can tell you firsthand from being on site at Surfside for 2 weeks straight, it seemed like we were there for a long time, and we didn't want to give up hope. It was a very difficult thing. There was a lot of emotion, of course, for the families. There was a lot of emotion for people that had escaped the other tower, who no longer had a place to go back to. And you had these folks who were there working on that pile, doing whatever they could to try to find any sign of life, and it was tough. And as emotional as it was, of course, for the victims' families or for people that were displaced, it was very, very emotional for the folks that were there responding. And it's not an easy thing, and they poured their heart and soul into that mission. And we see that in other aspects, too, of these jobs. It's not easy. It's difficult, and it causes, yes, there's physical burdens. You're putting yourself out at physical risk of stuff. I can tell you that in Surfside, the first day out there, It was obviously very traumatic to see the wreckage, but as you went another day or two in, the smoke and the fires that were happening, I mean, just standing 100 yards away, you're like, and you had these people that were in there the whole time. So there's clearly risk there, but it does take an emotional toll when you are having to do this type of work, the type of stuff that you're exposed to, the trials and tribulations of being involved as a first responder. So we recognize that in the state of Florida, and yes, we can offer support in terms of bonuses or pay or all that, and that's meaningful and people really appreciate it, but we also understand we need to have resources as people have challenges involving mental health resiliency, and the First Lady has really led the effort and led the way on that from the very beginning. And I'm glad to be able to be here with her today, and we'll turn it over to her to let her make the announcement and then to engage our great folks here in a conversation.
Yeah, no, when we were thinking about it, it's 2019 really after you were elected that we started having these conversations. I remember being at the governor's mansion with Dustin and Rick and Megan, your wife was there at the time, and talking about how important this issue is, and really another opportunity for us to be here today is to just say thank you yet again for putting yourselves out there in the line of duty. I think there was a study that came out that says the average person sees 2 to 3 traumatic events in their lifetime. But if you're a first responder, you see something on average like 180 of these traumatic events over the course of your career, if not more. And that does, as the governor says, take such an emotional and mental toll. Not only on you, but also on your families too, who at home have to try to do what they can to help in the best way that they know how. So that's one of the reasons why we're here. Another reason why we're here is a really disturbing study that we were reading, that more first responders lose their life to suicide than they do in the line of duty. And so that's why the governor said from the very beginning, we've been committed to making sure that you have the help that you need. And we're just going to build upon that. We did that with the $5 million towards the crisis counseling services through the 211 network. We're going to get into why that's so important because of that peer-to-peer component. Being a veteran, when you answer the phone and there's a veteran on the other end of the line, you have that connection that other people might not have, and it makes a world of difference, and you can talk to that, of course, Manny, in just a second. And then also one of the initiatives that I spearheaded was Hope for Healing. There are so many great resources out there, and they shouldn't be in a siloed approach. They shouldn't have the nonprofits over here and the private sector here and the government here. Hope for Healing really is, and it's really from the brainchild of the governor saying, I don't want you guys to work in silos. And I said, okay, great. How can we collaborate more to make sure that we're maximizing the resources, and we also have accountability for outcomes? And one of the ways that we've done that, one of the many ways, is Hope for Healing, and that website is really an aggregator for first responders and others and students and teachers to be able to find the resources that they might need to help make a difference. So today we are very excited that we have money going towards first responders specifically for their resiliency and their mental health. And so the total of $12 million is going to be put forth through the Department of Children and Families, and it's going to go to the 6 DCF regions. And then from there, you'll be able to apply, and it'll be able to filter down locally, because we know what works in some areas might not work in another area, so localizing it. And again, the most important part of this is that you have the peer component. So just like we have at the Crisis Network, where you have a peer-to-peer with the veterans, it's so important, and I think Dustin can talk to this, if you don't have those lived experiences being out in the field and seeing one of those 180 traumas that a lot of you guys endure over the course of your careers, if you don't have the perspective, then it's hard to really break through. So we hope that this $12 million is going to be able to be used in a great way to be able to provide opportunities that might not have been there before. So we'll get into your perspectives and how I think this is a game changer for the state of Florida, and yet again shows that we just wrap our arms around the law enforcement and first responder community in so many ways. And again, this is just more than anything else just to say thank you for your service. Thank you for what you do. At the governor's mansion, our kids love to hear the sounds of the firefighters and the fire trucks and the ambulances when they come by. And they always always have to run to the windows to look, and they say there they come to the rescue again. They absolutely, at the tender age of 5, 3, and 20 months, and it's the 20-month-old that really wants to see the fire trucks and the ambulances more than anything. But they recognize what you guys are doing and putting yourselves out there for the benefit of all of us. So thank you. And with that, I'll let Secretary Harris talk a little bit more about how important it is for your agency to be doing this.
So thank you, Governor and First Lady, for your unwavering support of Florida's families. It has been a true blessing to have leaders who are so involved in our behavioral health system and who understand the effects that mental health can have on all facets of life. Part of our state's vision is to have a comprehensive behavioral health system of care that meets the needs of all who need services. It is essential to work in partnership with local communities to build upon the continuum of care that's already established. The earlier we can get individuals the help they need, the better the outcomes will be. Our state's law enforcement officers, firefighters, and emergency medical personnel have selflessly dedicated their lives to protecting and serving Florida's communities. They walk into some of the most challenging and dangerous situations, and it's important for us to recognize the toll that can take on their own mental well-being. Many crisis intervention programs for first responders are created in response to a specific disaster or state of emergency. So we're so excited that this funding opportunity, because it focuses on building capacity to better meet the needs of first responders all year round. First responders are the heroes of our areas and should always have assistance and resources at their fingertips whenever needed. With the $12 million, we will initiate a competitive procurement that focuses on expanding access to critical mental health resources, including peer supports and information and referral services. In addition, respondents will have the option of providing behavioral health services like therapy services in person or telehealth for those who may need additional support than what their insurance covers. As the First Lady described, the use of peers is so vital to individuals feeling comfortable asking for help, knowing that they will be assisted by someone who's walked in their shoes. These peers will be specifically trained on how to conduct individualized screenings and assessments so that they can quickly link first responders and their families to needed supports. In addition, they'll be responsible for following up on periodic intervals after referrals have been made. The procurement will also result in a creation of a standardized training and resource toolkit that will enable first responder agencies to offer training to their employees with a focus on prevention through improving mental well-being, stress management, and ways to effectively cope with trauma. By creating this robust toolkit, we hope to establish an online repository that includes customizable materials for first responder agencies to meet their local needs. The department received this funding from our federal partners and will use it to build upon existing programs tailored towards first responders, allowing organizations to serve more people or assist local areas with creating programs where none exist. We'll be releasing the procurement shortly and encourage interested organizations to apply. I want to end by thanking our first responders in this state. You truly are our heroes. Because of you, we feel safe in some of our most vulnerable moments. This initiative is just one of the many ways that the First Lady and the Governor continue to demonstrate their commitment to you all. So thank you.
Nicole Howard, first of all, thank you for your service. You're with the Pasco County Sheriff's Office. Let's talk a little bit about the peer-to-peer component, because you were a little skeptical of it as first. Tell us your story and how it evolved into where you are today.
So in 2013 and 2014, within about a 7-month period, I was involved in 2 shootings. Not a place where any law enforcement officer wants to be. But ultimately, you put in that situation and you have to address the issue. After the shooting, I was involved, able to become part of a debriefing. As part of that debriefing, I wasn't really interested in being a part of it. Ultimately sat through it because I was told it would benefit myself as well as my coworkers. Sat through that and ultimately came out better on the other side of that debriefing. And that debriefing was done by peers in our community that understand what I do. And so as a result of that, I joined our regional peer support team, our critical incident stress management team, which is actually ran through a 501c. And so someone had the forethought of mental health resiliency years ago and created this 501c. And so we joined that team. We started our own critical incident stress management team within our sheriff's office, and then recently added a peer support team. So it's very important that coworkers are able to understand and take care of each other, but also understand that they need higher level resources, because I can't solve everyone's problems. One resource that works for me, the debriefing itself worked for me, may not be okay and work for somebody else. So there has to be multiple resources. There has to be education on the front end. There has to be education on the back end. You do this job for 25, 30 years. At the end of that 25, 30 years, how do you transition back into quote unquote civilian life where you're not on an edge, where you're not having to watch what's going on around you, where you're not waking up in the middle of the night frantic because you're expecting a call or expecting a call out. How do you go through that? How do you navigate that system? And so starting early on in the academy and then all the way through retirement, I think this program will be very beneficial to all of our members.
Thanks again, and the training on top of it is just so important. Yeah.
Training continually throughout their careers. Yeah.
Thank you. Manny, first of all, thank you for your service too in the United States Army. We appreciate your tours overseas, I think 2 tours. You also are one of the veterans over at the Tampa Crisis Center. And for people who don't know, you're on the front lines picking up the phone calls. If someone identifies themselves as a veteran, they get passed off to you if they are in some way thinking that they might take their own lives or are having a crisis. So talk about what that's like for you to be able to be there and why your shared and lived experiences make such a difference in the eyes of the person on the other end of the phone.
First off, thank you very much for being that government that considers and understands the power of mental wellness. I had a good speech put together, but receiving these news kind of blanked me. But I'll tell you a little bit about what you just said. So yes, as you mentioned, I am a combat veteran. Separating from the military back in 2006, I believe it was, yes. I found myself seeking the help of anything. Now you have to understand, I joined the military as a young 18-year-old, very ignorant kid. And then I spent a bunch of years in the military as a soldier where life was easy. I was to do what I was told. I can do that. Suddenly after Iraq, I ended up separated from the military. And then now as an adult, I have to figure out how to be a civilian. Well, I haven't paid a light bill or a water bill, so it's the little things, right? So my story developed within 2.5 years. That's when I started getting connected and my recovery started. But now I have the opportunity to serve and do the same for those who perhaps spend more than 2 years or perhaps just came out of the service. So by being in the community, ready, willing, and able to serve as a brother to my brothers and sisters allows that rapport, and like we all know, that similar lived experience, it's a powerful tool. And like the lieutenant is saying, our intentions is not to cure. Our intentions is to allow you that room to sit and be heard. And once you are heard and you feel heard, yes, that poisonous kicks in. And now we can make those proper decisions to figure out what resources we're going to use. And it's a tool we've used with the Florida Veteran Support Line since 2014 when we began, and a few years ago it became a state thing. And we're hoping to use the same approach with another connection to, but specific for first responders. With that in mind, having a peer ready, willing, and able to connect with the first responders that call in and just have a conversation. Allow the room for that person to be heard. And then from there, we can continue our work.
It's just that first step that's so meaningful in finding and making that connection. So thank you for what you do, Manny. We appreciate it. By the way, Madison wanted to come and say thank you too. We thought she was going to sit off to the side, but she wanted to make a cameo, so we said fine. Dustin, you were with us in 2019 at the Governor's Mansion, and we had a roundtable discussion, and we had a lot of conversations about this. Not only are you at Indian River Fire and Rescue, you're also a chaplain. So a lot of people confide in you for help and support when they see a traumatic incident or other things. Talk a little bit about your story, your perspective, and why this funding is so important, you think.
It's overwhelming. It's beautiful. And thank you from the bottom of my heart, from my family's heart, from fire rescue and law enforcement. Coming from a law enforcement family to talk about feelings and emotions is a challenge at times. After my father being 30 years in law enforcement, I've just now coaxed him in to snuggle with a struggle where I have to tackle him to hug the man. But he's working on it and growing. The interesting feeling that I had when I first met both of you to invite first responders into your home shows the importance of a tapestry, that every single thread as it's woven, with outreach, with law enforcement training, with the rule of reciprocity and funding, mechanisms of peer support, shows that the tapestry that you choose to weave is not one just of strong leadership, but its importance of showing that every single thread that makes up our community matters. And it's beautiful. What you're offering, what you have supported, what you've championed, to bring scarred, injured, hurting, broken souls into your home and say, what can I do to allow you to be seen as much of what you're doing right now? Going through a journey, an ordeal, difficult, intimate, personal, but still being willing to wrap the arms around those whom you love is what peer support is about. It's about diversity. What each person's need in their time of darkness is unique. Now, coming from the fire service, I'm not talking about feelings. After 20 years and being a company officer in Indian River County Fire Rescue and a chaplain, to have the struggle of suicidal ideation creep in on a daily basis, struggles with addiction, and ultimately injury that we sustain from the job. As most of the firefighters know in the room, I'm a hit at pool parties when my shirt comes off, not because of my slim figure, but because of the scars that I carry from my job. Fortunately, the sense of humor and gallows humor I've developed is an offset and a survival skill. First responders have a talent, a gift of it. Offensive at times, but it's a survival mechanism. Why? Because our worldviews have adapted. Every time the tones go off, our worldview, the way we interact, changes. It mutates. What you are doing, what you started to do 2 years ago when you invited us in our homes, what this opportunity affords is growth. It shows us that we do not go at this alone. I was taught very early on the power of peer support. After being burned in Indian River County on a fireboat, watching my crew, having to watch me burn alive with nothing that they could do, going through the painful recovery process of thinking that no one else would understand what I am supposed to fix and have the answer for everything. But I cannot stop seeing people that I've put in body bags, kids, families that I've scraped off the roadway and zipped up and gone back to my home and acted as if I was normal. No one will understand this. Once a person feels alone and isolated, they find darkness. Once they lose the imagination that tomorrow has an opportunity for healing, it's a dangerous place to try and survive. Suicide in the first responder world, and veterans, law enforcement, even our nurses and ED staff working through the pandemic over the past 2 years. When you feel truly hopeless and suicide becomes the option, the solution of peace, I can tell you from personal experience, from working with thousands of firefighters across the state, it is not a sign of weakness. It is the overwhelming, most difficult thing to override as a human being is to take your own life. First responders, having another brother or sister that sits beside them and teaches the rule of reciprocity and love, much as you did when you invited us into your home. You saw a problem, sought a solution, and set forth a plan. First responders and peer support could save a life. Previously, we thought that we would judge one another. Heck, for a law enforcement officer to say, I'm struggling with the effects of the job, the first thing they would think is they would lose their badge and their gun. A firefighter to say that, I don't think I can put another family in a body bag. I don't think I can pull another child out of a pool or deal with another overdose or watch another family lose everyone they love and feel helpless. No training can prepare me for this. If I speak upon it, I will no longer be able to provide for my family. I'll never protect my community. What you find is the first time peer support is offered. And what you're doing today here is monumental. Do not take it lightly. Grasp onto Madison with love as you always do. Hold your husband's hand as you head back to the governor's mansion. Be thankful for the gift of love and family and support you offer in difficult times. Peer support allows for healing. My brother, William French, works for St. Lucie County Fire Rescue, and the day that I attempted to take my own life, he saved mine and did the exact opposite of what we thought in the first responder field would happen. I thought he would judge me, think I was weak. He did not. He held my hand, walked side by side, and showed us what culturally competent care, what clinicians, when they get us and understand us, when they're accessible in our time of need, peer providers that I can reach statewide at any point, at any time. It saves a life. So thank you for being a part of a solution. For those who said first responders do not suffer from the effects of this job, that we should be stronger, that we shouldn't struggle, come ride with us on the trucks. Thank an officer for their service. Thank a veteran for the ability to salute the flag. More importantly, thank leadership, such as yourself, for being part of the reason that we are lessening the impacts of the human ordeal. And you are part today, and every organization that will apply for these grants under DCF, to have the opportunity for diversity to save a life is going to be the reason we have one less folded flag on a casket in the coming days. And it's humbling. So I get back on that fire truck with pride, knowing that we have leadership that sees us. You took time to thank every first responder, and you set an example, much like you set an example with your daughter now, of the importance of love. You're giving the opportunity for peer support to show the ultimate gift of love, and I'm humbled, I'm thankful, and I look forward to all of the organizations that are going to have the opportunity to apply to this, to allow peer support, to actually, the alarms go off in our first responders' life, to have the ability to answer it. So thank you comes with the ultimate gift of love.
We should thank you for everything that you've done, and that was eloquent, and we appreciate your service and everything that you do to save lives. And then Rick, we know you were there at the governor's mansion too, along with your wife, Megan, who unfortunately couldn't be here today. But both of you are on the front lines, no pun intended, both with your service, but also with this initiative, because this really hits home to you.
Yeah, a little backstory, I guess back in, I believe, September of 2017, my brother-in-law, my wife's brother, retired Tampa Fire Rescue for, I believe, close to 30 years, committed suicide. November of that same year, she started just Googling and researching everything about PTSD, and somehow stumbled across the bill. I believe it was Senator Book and Representative Wilhite that had put together, and she went to Tallahassee every single session, and ultimately Governor Scott sat right there and signed the bill into law. And then Governor and First Lady took office, and then you invited us to the roundtable. I believe it was in 2019. I know mental health is very important to my wife and I because of what happened to her brother, my brother-in-law, and the fact that she has a younger brother on the job. We have 3 nephews on the job. Stevie's son's actually on the job. He's got, I believe, 3 years now. And then just our children are young, and some of them expressed interest in becoming firefighters in the future. So I appreciate everything that you guys are doing for us. I know I was down there at Surfside, and I've been on Florida Task Force 3 for over 20 years. And all the deployments that I've been on, from Katrina to Michael to countless other ones, basically when everything's all said and done, they just look at you and go, "Are you good?" And typically the firefighter in you goes, "I'm good," and you go home. The first time in my career being deployed at Surfside, there was hundreds of counselors around that camp. I mean, I've never seen so much of a outreach to us first responders. I mean, they were putting their hand on your shoulder, hugging you, whatever they could do. They would hand you a bottle of water, whatever they could do. I've never seen so much, I guess, care for us in my entire career. I've been on 25 years, and the first 20 years of my career was basically the suck it up, get on the truck mentality. And it wasn't until I guess the last 4 or 5 years where it's becoming more appreciated, more known, and I thank you for that. Like he said, that's some of the things that we do as firefighters is we just internalize and we talk about it at the fire station, and unfortunately some of us cope poorly on our days off, which it's fantastic for all these different organizations coming out to support us. So thank you for that.
Thank you for what you did, and thank you for your service at Surfside. So hopefully you'll see more of that. You'll see more people coming to greet you, you know, at tragic events with an arm wrapped around you, a bottle of water. It might seem small maybe to some people's eyes, but I'm sure it's a big deal for you guys, just the recognition of it. And I know more people would be doing that if they knew. And so half the battle is letting people know that it's a big deal. So thank you all for what you're doing. Thank you for your service, and hopefully this $12 million will just be the start on what we can do to help get some much needed support for your service. Thank
Madison, you want to say hi to everybody?
you. And say hi. She's a little shy.
Can you tell them how old you are now?
You can.
You can do it.
She wouldn't stop talking when we left before we came in here, and now all of a sudden she has nothing to say.
No?
But she just had a birthday. She just turned 5 years
You just
old.
turned 5 years old.
Very
so
precocious
happy birthday.
5-year-old, by the way, who runs the household and sometimes does her own roundtable conversations, which are very interesting, and she makes grandma and everybody come and listen. So we don't know really what she's talking about, usually about dinosaurs, because she has a thing about dinosaurs. But now you have not much to say, right?
All right. Okay. Anyone have any questions?
Governor DeSantis, I have to ask you, unaccompanied children are being forced out of shelters here in Florida because DCF is not renewing their license. This appears to be in direct response to your executive order that directed them not to renew the licenses of these providers that service specifically unaccompanied children. Governor, why are you bringing kids into this immigration?
I want our resources focused on needs for Florida kids and the needs we have in our communities. These are people that are coming from other countries. They shouldn't obviously be allowed into the country. This is an open borders policy, and it's diverting resources from being able to service the communities here. And so everything we do is about helping our folks that are here. And when they're bringing people in the middle of the night from the southern border into like Jacksonville, you know, that's not what we're looking to do in the state of Florida. You know, we want our resources going to folks. We've got a lot of needs. We've got a lot of folks. And yes, we've done well as a state compared to all these other states. A lot of people want to come here and everything. We're proud of a lot of the progress, but man, we have needs here. And so we don't want Florida to be the place where they bring people in the middle of the night for a problem that they created by not enforcing the law, by not securing the border. And it's been a disastrous policy. And we want those resources focused on Florida kids and American kids. We don't want to be the place where those kids are being put to the back of the line because Biden is airlifting people in from the southern border.
But these are shelters.
Okay, I've answered your question, thanks.
So you're the governor who turns it
Yes,
down?
ma'am.
So, Governor, as you're talking about right now, there has been a spike in human smuggling, and the latest data from the bipartisan advocacy group says that 42% of our agriculture workers are undocumented. So my question for you is, one, how much do we rely on undocumented workers, and can we realistically fill these jobs without undocumented workers?
I think everybody should be lawful in terms of employment. The reality is that's the law, and I think the law should be followed. I don't know. You hear these different statistics. I don't know where they kind of get this, but I think people need to be here lawfully, and I think we want to make sure that Americans are first in line for a lot of these jobs. Now, there's different demand in different segments of the economy. I get that. But at the end of the day, I believe in a legal workforce. I think that's the best policy for the state of Florida, for the United States of America, and it will also, again, make sure that our key resources, public safety, education, healthcare, all those things, are really focusing on the folks you know, that are Florida residents and Florida citizens.
Secretary Harris, can you talk to us? It's your first time in the Bay Area since we have a new agency in charge of our local child welfare. A lot of foster parents are worried it will be more of the same. It will be just like Eckerd with this new agency. How do you help them rest easier about the children they're taking care of?
Thank you for that question. We are really excited and honored that was selected to serve as our lead agency. We think that they have a proven track record of high performance as it relates to child welfare services. And one of the priorities that we focused on is community engagement. So we really focused on hearing from foster parents, from those who are in the field, or case managers, et cetera, because we really want to build a new day and have things be better and different than the experiences that those who are being served and who've been working in this field have experienced in the past.
You mentioned rebuilding. What has to be rebuilt?
Making sure that we have stronger front-end processes to ensure that we are keeping families intact whenever possible, and we are only removing when necessary, as well as getting kids out of our foster care system and finding permanency as quickly as possible.
The final thing I'll say, we got to run. I got a daughter, but if you look at the jobs report today throughout for the country, it's like 200,000. I think it was less than 50% of what was forecast. I think there's a reason for that. I mean, I think there's a couple reasons for it. I mean, one of them, you know, we do have inflationary policies which are harmful to businesses and into individuals, and we're seeing that in family budgets with groceries and gasoline and the whole 9 yards. But you also have an administration, they're trying to impose more restrictions with respect to the COVID. And that is not going to allow us to perform well as a country if they're constantly threatening to restrict people. Fauci would not rule out lockdowns. Biden said no lockdowns for now, which, well, what would happen in the future? You can't restrict people, you can't mandate, and as long as they're stuck in that morass, you're going to continue to have economic performance that is going to be subpar. And then contrast that with Florida, where we have been the engine and we have been pulling way above punching way above our weight because people know you're going to be able to go to work. Your kids are going to be able to go to school. Businesses are going to be able to operate. Everyone knows that, and they know that that's what is going to happen. And so this is lackluster. I hope that you'll see turnaround in the more recent months coming up. But I think that this is a function of some of these policy choices that are being made out of Washington, and those are not working out for the American people. So let's let people make their own decisions. Let's make sure we get as many people back to work as possible, and let's just send the signal that things like lockdowns and all these other things, those should not even be under discussion. They have not worked. The restrictions have not worked. If you look right now, and I predicted this summer when everyone was criticizing the South and Florida, we have a different seasonal pattern. We have summer, they have north. What's happening now in the north in places like Michigan and Maine and New Hampshire? They have pandemic records for hospitalizations with heavy restrictions and all these other things. So it doesn't work, and you empower people to make choices. I was happy to actually hear the White House talk about monoclonal antibodies, which we did in the state of Florida and had huge success keeping people out of the hospital. If we had monoclonal antibodies on the front burner in this country from the beginning of 2021, it would have saved probably 100,000 lives. There's people in other states, they don't even know about them. They don't know how to get them. In Florida, we really changed that, and I can tell you, because people have written into our office, there are people who didn't know about them, but then saw me talking about it. Word gets out outside of the state, and then they started asking, and they got the monoclonals, and it ended up making them much better. So we know that those work. We know that it's something that needs to be kind of the standard of care. If somebody is high risk and they're infected, and oh yes, Like I've said from the beginning, or certainly from the summer, people are getting infected who have been fully vaccinated. That's just the reality. And so most of the people that get monoclonals in Florida are fully vaccinated. Probably 2/3 of them are fully vaccinated. So regardless of that status, if you are high risk, this should just be the standard thing that you do if you do get infected. And so if that was the approach, then I think you'd see a lot more confidence. But when the market was rattled with when the press was talking about that a lot, it wasn't because that they were worried about Omicron. They're worried about governments doing destructive things in response to Omicron. That is what shook and rattled the markets. That is what people were concerned about, the destruction that happens with these heavy-handed, failed policies that we've seen over and over again, and that people like Fauci will continue to parrot and will never admit that they have been ineffective. So we're gonna hold the fort here in Florida, but man, we could be putting a lot more people back to work nationally, but you gotta empower people and you gotta protect their rights to make their own decisions. Thank you very much.
Governor,